am excited to welcome you to Live Healthy Naturally, a podcast about how to get healthy and stay healthy naturally. I'm Dr. Samya Sridharan. You can find us on all major podcast hosts, including Google, Apple, Spotify, and iHeartRadio. October is Breast Cancer Awareness Month, and this episode is dedicated for that. But what is awareness? Just knowing the signs and symptoms of breast cancer, or detecting cancer once it's already there in the breast? Or is it truly trying to know the things that we need to do before it even gets to us? Traditional advice is to do self-exam of the breast, to do yearly mammograms if you have a family history of breast cancer or a concern of having a lump or a cyst in your breast. But is that an indicator of breast health? Does it give us enough information about our breasts? And does it predict the possibility of developing breast cancer? Many a times in my practice of 18 years, I've seen women coming running whenever they have any tenderness in their breast, or they have pain, or they have found a lump or a cyst in their breast, or heaviness in the breast. That is the time they actually start to wonder if there is something going on with their breast. What could be happening in their breast? Is there a possibility of them developing cancer? And if they have a family history of cancer, obviously that makes them even more stressed about it. And then they want to know what they can do about it. But what if, just like us brushing our teeth every single day, we don't wait until cavities appear? We teach our children, as soon as they have their first tooth, to start brushing their teeth. Even when they resist, even when they don't like it, we tell them, no, this is actually a good thing. We don't have to wait until you have cavities. We know now enough to know that if we brush our teeth every single day, we may be able to prevent cavities. And the same way, what can we do in this case so that we are not diagnosing once the cancer is already there? That's not prevention. We need to diagnose it, or we need to understand the health of our breast, the functions of the breast, and where it's going, the trajectory of it, so that we can actually prevent it from going there. Isn't that the best thing possible? Isn't prevention the best cure out there? Did you know a woman is diagnosed with breast cancer every 29 seconds around the world? That's insane. As I finished saying the last two sentences, someone's life was changed forever by that diagnosis. The amount of stress, the amount of fear, pain, and financial loss a family goes through, let alone the possibility of the woman losing her life. The battle against cancer is just immense and draining. Breast cancer is the most common type of cancer in women in the United States. Did you know that 1 in 8 women will die of breast cancer? And every 74 seconds, a woman somewhere, in some part of the world, dies from breast cancer. So what are we doing to prevent it? What do we know? All the women listening to this, all the men listening to this, who knows a woman, whether it is your wife, your child, your mom, your friend, what do you know they are doing? Are they doing anything to understand their breast health? Do we have enough information to be able to prevent it from happening? Did you know that just imaging the breast is not a sufficient action to prevent breast cancer? In our last episode, we talked about the lymphatic system. And for good reason, because the health of our lymphatic system is essential to prevent breast cancer. So what do we know about the lymphatic system, about our own lymphatic system? And what tests are there that you have done in the past to know about your lymphatic system and its health? What tests have you done to know how functional your breasts are and all the tissues in your breasts, what they are doing? Did you know that the breast is composed of just adipose tissue and lymphatic system, pretty much the lymphatics. And of course, the lactating mother also has, lactating ducts. But this is what pretty much it is. And if that is the case, if there is breast cancer in any woman, it should be because of either the adipose tissue or the lymphatic system. And as we have discussed in the last episode, lymphatic system is pretty much the sewer system of our body. And if this sewer system is not working well, guess what? It actually starts putting things in places that it shouldn't be putting it in. And then the body eventually causes issues, causes mutations. But cancer is not something that develops overnight. It takes many years to develop, which means that we have the ability to stop it from going in that direction if we just know enough, if we learn enough. Did you also know that your gum and oral health also contributes to breast health? In today's world, we actually constantly hear about how every organ is so separate and we go to different doctors for every organ, which means that we are never really looked as whole, as one. But in our body, that's not the way it works. Every single cell is talking with each other. It's communicating constantly. And there is this whole system called as the meridians. They are like rivers. Their energy flow goes through these rivers. Our energy flow goes through these rivers. And these meridians carry energy throughout our body, and they connect organs all over, and they connect our teeth, our lymphatic system to our breasts. So when there is so many different things that contributes to breast health, how could we just x-ray the breast and know that it is okay, when the problem could be coming from elsewhere and not even from the breast itself, but just becomes a problem or just shows up as a lump in the breast, and we think it is the problem of the breast. So in order for us to understand all of these things, we are actually conducting a free breast cancer awareness seminar. And this seminar is free for everyone who wants to learn about their breasts, or it is free for everyone who has someone who's someone who actually can benefit from this. Anyone who can benefit from this seminar should come. You'll learn more about what are all the factors that plays into someone getting any cancer, not just breast cancer. And the thing is that the things that I just gave you were just snippets. So we'll go into the depths of it as to what are the different factors that plays into it and what tools we have to know the health of our lymphatic system, the toxicity of our body, the detoxification ability of our body, and the functional health of our breast. This seminar is going to be taking place in McKinney, Texas on October 3rd, 2021. And we will actually have the link to the event for you to RSVP in the direction. Please join us. This is an opportunity to taking a step towards your health. And bring a friend, bring the family, but seats are limited. So hurry up and RSVP. And if you can't make it, cancel it, because we want this seat to be reserved for someone who is able to come there, learn, and change their life once and for all. And that's what this podcast is all about anyways. It's about giving you the tools. It's about giving you the awareness so you can take the steps towards your health.
I know you have things to do and places to be, and you chose to listen to me. Thank you so much for tuning in to today's episode. I'm Dr. Samya Sridharan, and it is an absolute honor to be heard by you. I hope you enjoyed and learned something from this episode. Show us some love and share with your friends and family. And be sure to tune into our next episode in 2 weeks. Much love and health. Until then.